Welcome to the recorded version of Medication Mismanagement, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Okay, we have two presenters here with us this morning. Lakeland Hogan is a gerontologist and caregiver advocate for Home Instead Senior Care. Lakeland works to educate professionals, families, and communities on issues older adults face. Lakeland is a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. She has a Master of Arts in Social Gerontology and a Master's in Business Administration from UNO. Lakeland has professional experience in the private and public sectors of senior care services. She has worked on special projects for UNO's Department of Gerontology and the local area agency on aging. Lakeland serves as Vice President for the Board of Directors for the Dreamweaver Foundation and is active in the Alzheimer's Association's Walk to End Alzheimer's. Lakeland has a passion for helping others, especially aging adults and their families. Also joining us this morning is Kyle Decker. Kyle received his Doctor of Pharmacy degree from Butler University. He is Six Sigma certified and has developed concepts into operational processes to provide a safer way for patients to self-administer medications. Throughout his career, he has been at the forefront of driving medication adherence, medication synchronization, customized patient packaging, proactive refills processes, and other tools that empower patients with multiple disease states and complex profiles. Kyle is a member of the Pharmacy Quality Alliance, National Community Pharmacists Association, and Indiana Pharmacist Alliance. He is married to Cassie and has one daughter, Ren. And with that, I would like to turn the presentation over to our presenters here this morning. Lakeland and Kyle, welcome.
Thank you so much. Hello, everyone. We're so excited that you've joined us today. I'm very happy that Kyle will be co-presenting with me as we talk about a very important topic. We know that proper medication management is key to older adults taking medications for various chronic conditions and other health issues. And throughout today's presentation, we're going to detail some of the research that we've done at Home Instead on medication use among older adults. And one thing that we found is that as the number of prescriptions taken by an older adult increases, so does the risk of medication mismanagement and also potential health risks. So Kyle and I will be talking today about medication mismanagement, how it can jeopardize an older adult's health and independence, but more importantly, we're going to be talking about ways to improve medication management and compliance. And we'll get to all of this in the coming slides. But first, I wanted to overview our objectives for today. So by the end of today's presentation, it's my hope that you'll be able to better identify potential risks associated with medication mismanagement and also be able to be more aware of the common medication challenges for older adults and signs to watch for when a medication might be causing other health issues. We're also going to go over the common conditions that could impact medication management and also identify the role in families, in the role that families play in reducing the potential of medication risks, medication mismanagement. We know family caregivers can play such an important key role in the medication management process. And then finally, we'll leave you with some resources that you can pass along to the older adults you work with and to the family caregivers that you work with. So I mentioned research, and I wanted to share some of our additional findings with you. It may be surprising to you, but in the research that we conducted, we interviewed over 100,000 older adults in North America, and a lot of them admitted that they end up in the hospital on an annual basis because of a medication management issue. We found the number of prescriptions, as I mentioned, increases as a senior ages. So those 70 and older are at a higher risk of having medication management issues and challenges because they're more likely to be taking more medications. We also found that 20% of the seniors we spoke with had difficulty managing their medication. In fact, nearly 1 in 5% of those surveyed felt overwhelmed, at least occasionally, by the medications that they're taking. And 1 in 5 reported that they do not take medications as directed, which I'm sure you can imagine that can cause some issues. And then for those older adults that are taking multiple medications, about a fifth of them said that they do not know if they have a full medication list, an up-to-date current list of what they're taking. So just to kind of recap all of those great statistics or pieces of research, the more medications that an older adult is taking, the more likely they are to have challenges that can put them at risk for medication management. And the older adults themselves are admitting that managing their medications can be overwhelming. And a good portion of them are not keeping an up-to-date medication list. So this may come as no surprise to you, but when you think about it, getting a good medication management system in place for older adults is so important and key to avoid medication mistakes, medication mismanagement. So when we talked with the older adults that we surveyed, we asked about these medication mistakes. And 1 in 10 said that they unintentionally made a mistake. And of those who did make mistakes, 11% had a medical issue or an emergency as a result. About a fourth of the seniors said that they do not feel fully confident in taking their medications correctly. And over half of them said that they're taking more than 4 prescriptions on a daily basis, and about 27% said they're taking 6 or more. So that's a lot of medications to manage. When we think about the role that the family caregiver plays, it's really important that they have conversations with their older adult loved one about their medications and really understand what medications are being prescribed, how the older adult is going about their medication management. But the reality is that not all family caregivers are having these discussions. So of those that we talked to in our survey, they said at least half of them said they do not have conversations with their aging loved ones about medication, but they do agree that it is important. So if you think about the older adults and the families you work with, are they having these conversations? Those that we talked to said, the older adults said that they don't want to talk about this because they don't want to be a burden on their families. They don't want to worry them with medication issues. They want to be able to manage it on their own. And of those that are talking about it, they felt that this communication among family members about the medication really increased the confidence among everyone involved that the medications were being taken properly. So the majority of older adults that we surveyed agreed, about 77% of them agreed that medication management plays a key role in helping them to remain independent. Managing their own medications, they've viewed as important and really want to be able to do that independently. So hopefully, as we go through today's webinar, we'll provide some tips on how we can help support older adults in those ways. And unfortunately, I've seen in my work from time to time that an older adult has to make a move from a residential home setting to a care facility such as assisted living because medication management has become an issue. So if we can help create systems, medication management systems for the individual older adult to help them manage their medication properly, hopefully we can help reduce medication mismanagement, the risks that come along with it, and ultimately help them remain independent. And for many of those people, it means remaining independent in their own homes. But we know that medication management is common. There are some challenges associated with it, so it's important to know and understand those challenges. So the first is medication adherence. Medication adherence occurs when the patient or the older adult takes medication according to the prescribed dosage, time, frequency, and direction. A breakdown in any one of those elements has the potential to result in unanticipated side effects or complications. And poor medication adherence or non-adherence limits the effective management and control of the chronic illness or whatever the medication was intended for. So non-adherence increases the likelihood of preventable disease progression, increased hospitalizations, avoidable doctor or emergency room visits, and other problems arising from poor health, which ultimately can increase the cost of healthcare for the individual. Some key medication management includes getting timely refills and also remembering to take the medications on time. The National Consumer League estimates that 20 to 30% of medication that is prescribed is never filled. So getting those prescriptions filled soon after a doctor's visit can be key to medication adherence. And then, of course, remembering to take the medication is a big part of this adherence. Research shows that the rate of medication adherence drops after the first 6 months, and half of patients don't always take the medication as prescribed. And if we're looking at those who have the lowest adherence, it's lowest among those with chronic illnesses or those ongoing diseases. And that's an important thing to consider, because those individuals with chronic conditions, chronic illnesses, are usually the ones who need the medication the most to help manage their condition. According to the Journal of Medical Internet Research, another common challenge is that older adults want to remain independent and in control of their medication and their treatment decisions. And there are certain medications that are considered to be a threat to the person's autonomy, their independence, could also be detrimental to their cognition or their health. Some older adults are really assertive in seeking information about their medications. They actively monitor their health. They alter their medication regimens accordingly. And many of them go on to develop their own medication management systems, oftentimes with pill boxes or envelopes. They put medications throughout the home to integrate it into their everyday life. And for some people, this works really well. But for others, they might need assistance with the managing of their own medication. Another challenge that we find is worrying about taking too many medications. Many older adults express concern about, taking multiple medications. They're a little skeptical of the reason behind the medication, the true benefits of taking multiple medications, and particularly if they're taking multiple meds for the same condition. So, for example, if they're taking two medications for their hypertension. They're wondering, why isn't one med good enough? So they start to kind of question it. Most want to reduce the amount of medications that they're taking, as they worry that their bodies cannot handle the multiple medications. Older adults are concerned about the drug interactions. They perceive that doctors want to just layer on the medications rather than simplifying the medication regimens, and so they have concerns again about the number that they're taking, and if a new medication is added, it also can add a cost, and so that could be part of the concern around taking multiple medications. Another challenge is miscommunications. We all know that oftentimes older adults are seeing multiple doctors for multiple conditions, and sometimes patients just assume that their doctors are all using the same computer systems, they're communicating with one another, and this is often not the case. So we want to encourage older adults to make sure that all of their healthcare providers know their medications and what they're on, and that information is being shared so that the medications can be coordinated and hopefully reducing some drug interactions and unnecessary medication. Another challenge we find is adverse effects, side effects, and those drug interactions. So these types of issues can really trigger non-compliance in an older adult. So if an older adult is experiencing a side effect, a negative drug interaction, they might stop taking it. I once worked with a woman who started a new medication and it really made her feel dizzy, and she decided she was just going to stop the medication. So I asked her, did you consult your doctor? Did you call him first before stopping the medication? Did you report these side effects? And she said, no, I'm just going to stop taking it. So it is really important that again, the physician or the medical professional is consulted when when a new medication is added and an adverse effect, a side effect, is taking place. And these adverse drug reactions, they actually make up about 15% of hospitalizations that involve medications for older adults that are 65 and older in the U.S. And they can be fatal in some instances. So again, it's really important that those medication lists are up to date, they're communicated to the doctors, and that a med reconciliation is done at doctor's visits or with the pharmacist, so that we're making sure that none of the drugs are negatively interacting. So there's a few more challenges that I wanted to go over, and pardon me, the computer froze, so now I can advance the slide. Thanks for bearing with me there. So another medication challenge is the fear of asking questions. If you've ever been to the doctor's office and you feel like the doctor is kind of rushed, they ask if you have questions, but in the moment you can't really think of any. And it's not till you leave the doctor's office that you think of a question. That happens to me from time to time. And for an older adult, they might feel the same way. They feel that their physician or healthcare provider is rushed. They don't want to bother them with questions. Or they think of the questions after the fact, but don't follow up with the provider or the pharmacist. And so that fear of asking questions could stem from that. And also, a fear of asking questions could stem from the fact that they don't want to be perceived that they can no longer handle medications on their own. Again, that goes back to that independence that is associated with being able to manage your own medications. But we need to encourage older adults that it is in fact okay to ask questions. Call the doctor's office back, ask the nurse, ask the pharmacist questions about the medications. There's no such thing as silly questions when it comes to something as important as medication. And I mentioned the cost of medications briefly, but the sad reality is that for some older adults, their medications cost quite a lot, and on a limited income, it could be choosing between purchasing food and paying for prescriptions, or cutting costs in other ways to afford medications that they've been prescribed. So many of them might, instead of paying for those medications, they might not get that prescription filled or might not get a refill. So if costs are of concern, we want to help them find resources. The next challenge that we see is not taking medications in the proper way. Oftentimes, I've heard of older adults chewing, cutting their pills, taking too much or too little. And so for those that fail to read the label closely, they might take the med the wrong way at the wrong time. They might fail to take it with food if that's how it was directed. They might take it at the wrong time of day. And it could be that, if you look at a prescription pill bottle, some of the text on there is very small. So want to make sure that the older adults that we work with are able to see the medication, are able to understand the proper way to take the medication. If the older adult has difficulty swallowing, they can contact the pharmacist or the physician for an alternate form of the prescription. We'd rather have them do that than chew or crush the pill and take it in that way. A lot of times, pills are designed in a certain way because of things such as slow release, or there's a good reason behind why the medication comes in the form that it does. So if the older adult is having concerns about taking the medication, we want to make sure that they're communicating with their healthcare provider, because often there is an alternate form of the medication that might be easier for the older adult. Another challenge that relates back to that independence issue is they don't want to bother their family caregiver, their family member with their medication. I've seen often, one of the adult children coming over to help their loved ones set up the MediSet for the week. And sometimes older adults, they don't want to put that burden on their loved ones. But the good news is there's a lot of kind of pre-packaging services out there that could take that away and decrease that challenge for an older adult. And then one last challenge is in regards to the number of medications that older adults take. So I've talked about this already, but when an older adult is managing 4 or more medications, there's an increased chance of a medication error. So multiple medications could become confusing and difficult to manage. So we need to be aware that if an older adult is taking 4 or more medications, that they're finding a good way for them to manage those medications. So now that we know some of these challenges, there are also some signs that we should look out for when medications might be to blame for some health issues that an older adult might be experiencing. And when we think about medication issues, we really want to get to the heart of it, the root cause. And so distinguishing these side effects and reactions and illnesses is really, of course, best left to the professionals. But here are some just kind of tips and warning signs that we can educate families on so that they can get their loved one to their medical provider. And these tips were developed by Dr. Jane Potter. She's a geriatrician and director of the Home Instead Center for Successful Aging at the University of Nebraska Medical Center. And she says that it's always important to check with a healthcare provider before drawing any conclusions. But again, she helped us identify these 10 potential problems that could result from medication mismanagement or side effects. So the first is any new symptoms, and we've talked a little bit about that already. Any symptom that is new, such as dizziness, nausea, it could be a side effect or a reaction from the medication. So it's important, again, to always provide the healthcare provider with a list of medications that are currently being taken and who's prescribed those medications. And that can really help in managing managing and avoiding those drug interactions. So it's really important to make sure that that doctor has the updated list, and most importantly, that the healthcare provider, the doctor, is aware of any of these new symptoms that the older adult might be experiencing. Another thing to look out for is a change in appearance. Medication problems might cause a change in skin tone or color. It might cause the person to be more lethargic. They could gain weight, they could lose weight, they could retain fluid. So always seek out the cause of any of these changes by contacting the older adult's medical provider. Another warning sign is a full pill bottle. When we go to fill a medication, the intent is to take them home and to start that medication and build it into our medication routine. So if a family caregiver comes over to visit a loved one and they see that that pill bottle is still full, it's time to kind of do a little investigative work. See if maybe the older adult is confused about what the medication is or has forgotten to take it incorporate it rather into their medication management system or routine. Or perhaps they got 2 bottles filled and they're going through the first one and that's the second one. It could be as easy as that. But again, it's something to be aware of and something to bring up with the older adult if it is noticed. And then mobility issues. Dizziness and lightheadedness are potential side effects of some medications, including those used to treat blood pressure. So those side effects could really impact the individual's mobility and could cause falls. So it's really important to keep an eye on the older adult if they are experiencing dizziness, lightheadedness after a new medication comes about. Or if the side effects of the medication, if you know ahead of time that those could be potential side effects, it's really important that the older adult's living environment is a safe environment for them to get around in. And then the next is changes in thinking, reasoning, or mental acuity. And this could be the result, again, of a side effect of a medication. There's many potential causes for forgetfulness and other confusion, and medication could be one of those. So it's really important to report any changes in cognitive abilities or thinking, reasoning to the medical provider. So a few more warning signs here, pardon me. difficulties in performing activities of daily living. So if a caregiver is noticing that any of the side effects are impacting the individual's ability to provide care for themselves, bathing, restroom, eating, dressing abilities, it's really important that the older adult expresses those to their healthcare provider. Also, trouble sleeping. Some prescription drugs, including antidepressants, could potentially lead to insomnia or issues with sleep. So before taking any sort of sleep medication, it's important to talk with the healthcare provider about these issues that they're having with sleep so that a proper plan can be put into place. So again, we don't want any adverse drug interactions happening. So if sleep issues become a problem, it's important to discuss those with the healthcare provider. And then changes in appetite. Some medications can impact a person's appetite, either decreasing the appetite or increasing the appetite. A lot of steroid medications increase a person's appetite or makes them feel hungry more regularly. So if you notice that the individual's appetite has changed, that is a side effect that you would want to report to the healthcare provider. And then difficulties maintaining the home. When an older adult is not feeling well, it might be more challenging for them to keep up with the tasks around the house, cleaning, preparing meals for themselves, paying bills, running errands. So if you notice that the individual is a little more lethargic, they don't have as much energy after starting a new medication, then it's really important that that is, again, communicated to the healthcare provider because it could be an adverse drug interaction, it could be a side effect of the medication, and maybe the older adult needs some extra support. And then finally, the overall well-being. We just want to keep an eye on the individual's overall well-being. So when medications are not being taken correctly, oversight can really affect the entire person, all aspects of the person's well-being. So it's important to have the person's medications reviewed regularly, at least on an annual basis, or any time the medication is added to the medication list or removed. And again, this can help reduce those adverse drug interactions, make sure that the individual's overall well-being is top of mind. So these are some signs that health issues, these are some signs that medications might be to blame for health issues, but there are certain chronic conditions that can make medication management a little more challenging or might involve more medications than others. So I'm going to just run through these quickly, but arthritis, we know that there are many types of arthritis, and a lot of times older adults might be taking medication for pain, which could have some potentially hazardous side effects. So if an individual is using anti-inflammatory drugs for their arthritis, NSAIDs, it could lead to things such as stomach problems, heart problems, kidney damage. So it's important to really keep an eye on how often those NSAIDs are being used. A lot of those can be bought over the counter, Tylenols and ibuprofens and that sort of thing. So it's important that the medical provider is aware that those are being taken. Also, COPD, chronic obstructive pulmonary disease, is another chronic condition that an older adult might be taking various medications for. And we know that this chronic condition involves the lungs and the airflow, and so an individual, again, might be taking multiple medications. So we want to be on the lookout for any of those side effects such as weight gain, any changes in the individual's overall well-being, perhaps a fast heartbeat, shakiness. And so really those individuals living with COPD should be under close observation by a healthcare provider. And also if any side effects or any changes in the individual's condition occur, it's really important to report those to the healthcare provider. And diabetes is another chronic condition, and for many, it involves regular medication or insulin, and if an individual receives too much insulin or not enough insulin, it really can be detrimental to their health. And a lot of times hospitalizations occur because of both of those issues. So it's important to keep a close eye on the medication management for those living with diabetes. If they're needing to measure their blood sugars and then adjusting their insulin based on that, it's really important that a good system is in place and that they are regularly seeing their healthcare provider. And if any change in their condition is recognized, it's important to seek medical advice and treatment. Heart disease is another chronic condition that's very common among people here in the United States and among older adults. And there are various types of heart disease and heart conditions. And so oftentimes medications go along with those various conditions. And it's important that those medications, again, are communicated among all of the individual's healthcare providers. And if any changes or symptoms occur, they're reported. Stroke is another another condition that is important to kind of have a heightened awareness to when we think about medication. Oftentimes, after a stroke, medications are prescribed to prevent future strokes, and so missing these medications could really be detrimental to the individual's health. Also, blood thinners are oftentimes prescribed after an individual has had a stroke, such as warfarin, and there are different levels of these blood thinners that are specific to the individual. So I just recently had a relative in the hospital, and she is on blood thinner, and so when she came home from the hospital, a lot of things happened during her hospitalization, and one of the big questions that our family wanted to address is, is her medication, her blood thinner medication, at the correct dose? And so that was something that we worked with the healthcare provider, the pharmacist, to make sure that we all were on the same page and that she was getting the proper dose after her hospitalization that she experienced. And I want to touch on quickly the impact that cognitive impairment and other mental health conditions can have on a person's medication adherence compliance. And I'm really going to dive a little bit deeper into how to help an individual living with dementia better manage medication on the next slide. But we do know that Alzheimer's disease and other related dementias could impact a person's ability to manage their own medications. We know that Alzheimer's disease and other dementias are progressive disease. So as the individual moves through the disease process, they might need more and more assistance with their medication management. And I'll go on into a little more detail on the next slide. Depression, we know that it's not a normal part of aging, but it can be more common among older adults. And when it gets to a point that it impacts the person's ability to function, they might be a candidate for an antidepressant type medication. They might also be a good candidate for counseling, therapy, that sort of thing. But if they do go on an antidepressant, it's again important to do that med reconciliation to make sure that it's not negatively interacting with any of the other meds that they're taking. But also, if they are feeling better and want to cut back on a medication, and this is really true for any medication, definitely need to check with the healthcare provider before taking those medications out of the medication regimen. And anxiety disorder. Up until a couple years ago, anxiety disorders were believed to decline with age, but now we're really seeing it to be as common with older adults as younger adults. And in fact, many older adults with anxiety had anxiety issues or experienced anxiety when they were in their younger years. So it's really kind of following them through the life course. So again, we need to make sure if an individual is taking medication for their anxiety that it's at the proper dose, it's not negatively interacting with the other medications that they might be taking. And when it comes to medication management and dementia, on previous webinars, we've had people ask if we could go into a little more detail on some tips for medication management. So I'm not going to go really in depth on these tips, but I'll just leave them for you all to take away. You can download these slides, and hopefully this can help when working with an individual, probably in the more middle or mild to late stage Alzheimer's disease, when they might not know why they're taking the medications, they might not want to take them. There's a few tips here on this slide that can be helpful. So now I'm going to pass it over to Kyle, and he's going to really dive deeper into how we can avoid medication mistakes and medication mismanagement. So Kyle, I'll turn it over to you.
So now we'll talk about avoiding medication mistakes. As we know, medication mistakes can potentially even be deadly. So kind of a quick case study here. Consider a 92-year-old person living in an independent care community and is usually very skilled at managing all of his medications. But he was diagnosed with congestive heart failure, and the doctor prescribed a diuretic to eliminate fluid from his system. It worked, he got better, so he quit taking the medication. So the problem is he stopped taking the medication. Congestive heart failure patients should be on a long-term diuretic in most cases, and once that patient stopped taking the diuretic, the fluid returned and he ended up right back in the hospital. So his mistake was not being clear on what type of medication, how long it was supposed to be taken, etc. And we know that nearly 20% of seniors who are taking 5 or more prescription meds that were surveyed by Home Instead reported challenges in managing their medications, including how the medications work, what they're being used for, etc. And such medication mismanagement puts seniors at a higher risk for medical issues or emergencies due to incorrect dosage or adverse medication interactions, and potentially leading to devastating consequences. Each year, close to 100,000 emergency hospitalizations for adverse drug events take place in the United States for aged adults 65 years and older, and that's according to the CDC, so it's a major problem. And so what you see here on this slide is from Home Instead and Dr. Jane Potter suggested ways to minimize the risk of medication mistakes. The first one is the easiest to implement, and that's just to get a pill organization system or service. 50% of patients do not take prescriptions as prescribed, according to a 2011 Medication Adherence Who Cares study. And that's why pill organizers can be such an important tool. There's other types of services out there, such as Simple Meds and PillPack, that help align and package, customized package according to the date and time the patient should be taking the medication, so they end up with a single serving packet. So that can really increase adherence and reduce the number of medication mistakes. The next one is to make one doctor the gatekeeper to manage medications. It's very common for older adults to have multiple doctors. They could have a primary care physician, a cardiologist, an endocrinologist, and that can potentially be dangerous because we can't assume, as Lakeland mentioned earlier, that the doctors are talking with one another. So bring into the doctor appointment, the gatekeeper doctor appointment, all of the medication bottles along with over-the-counter meds so that they can cross-reference what they believe you should be taking to be accurate. The next one is to know why your loved one is taking the medication. There are studies out there that indicate that just knowing what type of what the medication is being prescribed for actually increases the adherence. So even if it's as simple as the blue pill is for my blood pressure, that's a step in the right direction. And always double check with the pharmacist to make sure that medications won't interact with other medications being administered when you pick those medications up or have them delivered. The next one is to call the doctor about any changes, very similar to what Lakeland was talking about earlier, but people know when they feel different than they should, especially after changing a medication. That said, it could also happen where seniors develop a reaction to a medication they've been on for a long period of time. So make sure that those issues are always brought to the prescribers during those appointments, or if it's outside of the appointment time, call and report those to the nurse. And then the last one on this slide is to keep regularly scheduled appointments and an open dialogue with your loved one's healthcare provider. Doctors a lot of times will not authorize refills if they haven't been seen, or if the patient hasn't been seen, or they miss an appointment. So it's imperative, to make sure those appointments are kept. And on the next slide, the first bullet there is if your senior is having trouble paying for medications, to talk with the doctor or the pharmacist. We're all familiar with the Part D coverage gap, and when the patient has to pay for a majority of the prescription cost, that can be a very troubling time for seniors. And oftentimes there's generic medications or alternative therapy that can be used rather than expensive brand name drugs. So always talk to your doctor or pharmacist about that. Maybe if it is a brand name drug that has to be prescribed, then pharmaceutical companies oftentimes offer discounts. The next one is to tell your healthcare provider if the senior is depressed. So as Lakeland mentioned, depression can make sticking to a medication regimen more difficult than it already is. And furthermore, we know that medications can sometimes contribute to depression. The next one is to discuss any problems an older adult has in taking medication. So this could be the inability to swallow oral solid medication or difficulty opening a pill bottle. There are solutions to these types of challenges, easy open caps. There's liquids in some cases that can be used for patients that have trouble swallowing large pills. And then the next one is to tell a healthcare provider if you suspect a loved one is forgetting to take a medication. It can be confusing, so always consult a prescriber with that. And then the last one on this slide is to consider a caregiver. Help your senior assess the risk of medication mismanagement. If you go to letstalkaboutrx.com, you can do an assessment and really identify what is the appropriate next step. Is it to have a caregiver companion? And I know Home Instead is a great resource for that. The next slide, medications and hospital discharge. This is a big one, and oftentimes it doesn't get talked about enough. When the patient is being discharged from a facility, whether it be a hospital, a long-term care rehab facility, they need to have somebody review all of their medications to ensure the compatibility, and then consult the primary care doctor, the gatekeeper that we talked about earlier. Because what happens is the patient has existing medications prior to the hospitalization, and then they're in the hospital and are on new, maybe unfamiliar medications, and they're being discharged on a different set of medications, and potentially even over-the-counter and supplements. So you want to make sure at that point of discharge that the discharging physician has provided clear instruction on which prescriptions the patient should be taking when they get back to their home or their assisted living facility. Also, make sure that those new prescriptions are picked up, and as well as included all of those over-the-counter medications from the pharmacy, and started right away. That gap in therapy between being discharged and then when they actually start the medications can also be, a major problem when they go without medications. And then the fourth thing is to, organize the pills, make sure that the confusion doesn't lead to a medication mishap. We talked about that a little bit earlier. And then the fifth one is documenting and tracking medications a senior is taking and when it will be taken, and that will help them more easily manage their health. The next slide is a really hot topic right now, opioids, the use and misuse. So we know that opioids are highly addictive, both psychologically and physically. From 1996 to 2010, opioid prescriptions written for older patients increased 9-fold. So the pendulum really swung out there, and then now it started to come back. So we're not seeing as many opioid prescriptions being prescribed, in around the 2010 timeframe, just because the awareness, of all of the problems associated with opioids. So the things to consider here, opioid abusers may experience emotional pain that could manifest in physical pain. So thinking about things such as social isolation, loneliness, especially after the loss of a significant loved one, or post-retirement, they oftentimes have a feeling loss of purpose. They may also, due to costs of managing pain or lack of saving, they may have emotional pain due to financial difficulties. They may be grappling with disease diagnosis or chronic conditions or type of dementia. They may also be experiencing a loss of independence, and that can cause depression. Or if they have a decreased physical mobility, it may take an emotional toll because they have a feeling of they can't do everything that they once were able to do. And then finally, medication management issues. We know this is a huge one. Multiple prescriptions, often coming from multiple providers. And Lakeland talked earlier about how important med reconciliation is. So that needs to be done at least annually, but whenever a medication is changed, then a medication management profile workup needs to be done either by a pharmacist or a loved one or the nurse or prescriber themselves. So opioid tips in avoiding misuse. The first thing is to consider non-opioid pain management. So NSAIDs, Lakeland talked about earlier, such as ibuprofen, Motrin, Advil, and then also acetaminophen or Tylenol. Also consider cognitive behavioral therapy or exercise therapy, which would be a type of physical therapy. And then also consider intervention therapy, such as injections for pain rather than oral solids or liquids. And then a couple other things is exercise and weight loss, as well as acupuncture and massage can be considered as well. The second thing here is to understand expectations of pain management. What really needs to happen is a pain management goal needs to be set and develop a treatment plan around that goal. And then ongoing assessment of risks and benefits of prescription opioids, and a follow-up if pain is not resolving as quickly as expected according to that management goal. Oftentimes there'll be urine drug testing during the course of your therapy to make sure there isn't other abusive behaviors going on, and then discuss the tapering of opioids to minimize withdrawal symptoms once the treatment is complete. The third thing is to work with a doctor to create a plan and follow up regularly. No options that we just talked about of non-opioid management of pain, and talk to the doctor about side effects and concerns. And the big one on this is to make an informed decision with your doctor on the appropriate therapy. The next one is to take and store opioids properly. The easiest way for people to abuse opioids is to actually take them from a loved one. So unfortunately, this does happen. So always make sure that you store in a secure place out of the reach of others, especially children. It's a federal law not to sell or share controlled prescriptions, so never do that. And then never take amounts in greater amount than prescribed or more often than prescribed. And the second to last one here, dispose of unused prescriptions, opioids at the end of your treatment. So there's community take-back programs, pharmacy mail-back programs. And there is an FDA med list that you're not supposed to flush certain medications down the toilet, but most medications are actually safe and recommended to be disposed of by flushing down the toilet. And then lastly, don't take opioids with alcohol or other like medications such as benzodiazepines, muscle relaxants, hypnotics, or other opioids. Going kind of fast here to get through the rest of this presentation. So the next one is acronym SIMPLE. So when, as a pharmacist, we're trying to impact patients' adherence and increase adherence, simplify the regimen. So take an extended release tablet once a day, for example, rather than an immediate release tablet 3 times a day. Also, small oral solid medications rather than large pills can really help, and avoiding things like pill splitting, which can just add to confusion and time involved with taking the medications. I is impart knowledge. Like I said earlier, just the knowledge of what the pill is being used for increases adherence. So imparting that knowledge on the patient's medications is very helpful. Modify patient beliefs in human behavior. This is one that I saw firsthand with my grandmother. For whatever reason, she always believed that when she felt better, she could stop taking the medication, similar to the case study I mentioned earlier. So modifying beliefs in human behavior, explaining that this medication will be taken for 10 days, or this medication you might be on for a year. That type of belief in human behavior perception is very impactful. P is provide communication and trust. Effective communication leads to better health outcomes. When both the patient and the provider are on the same page, the patient trusts that their health is in good hands. So always provide good communication. Leave the bias. A lot of times for L, patients don't it's not that they don't want to take their medications as prescribed or as they should. Maybe they don't feel well. Maybe it makes them feel icky. So just leave the bias at the door type of thing, and have an open mind with them when you're looking at their drug regimen. And the last, evaluate adherence. Lakeland mentioned this a bit earlier, but if you walk into the home and they have a full pill bottle, or their symptoms and health don't seem to be improving, then maybe it's time to look at, okay, how are they taking their meds? Is there another way to increase their adherence? Safe drug disposal. I mentioned this a bit in the last slide. So on the right side of the slide, you can see what to do with a medication that can't be flushed down the toilet or taken back to a drug take-back program. You want to mix the medication with unplaceable substances such as dirt or cat litter or used coffee grounds, and then seal that in a sealed plastic bag. Throw it in the trash. Make sure that you always scratch out sensitive or protected health information, PHI, such as the patient's name, address, phone number, etc. And then I mentioned flushing medications down the toilet. The EPA has really come out and looked at this, so the FDA has adjusted their recommendations accordingly. There's a list of medications on the FDA website. If you just search drug disposal, those are the medications you shouldn't flush, but by and large, most medications are it's safe to flush them down the toilet. And then lastly, hospice companies oftentimes will dispose of medications. And then the next one is communication. So this is a real big one. We know that it's important to remain helpful and positive with patients. Remain calm, and remember, it's not about control. Try to remain on your loved one's agenda as much as possible. Also empathize and try to put yourself in that person's shoes. Don't forget to listen. A lot of times, I know I'm guilty of this as well. I'm preparing an answer before I completely listen to the whole question. So make sure you remember to listen. And body language can have a big impact on the situation as well. If the person is relaxed and calm, this will show in their face and posture and the tone of their voice. And when visiting the doctor, be sure to take the time and really visit and understand and ask questions about the medication, ask about side effects, ask about possible adverse drug reactions, and so on and so forth. And have a good talk with the senior loved one and make the patient feel like he or she is part of the solution and is not losing control of the situation. I hear that a lot when patients get to a point where they need assistance with their medications. They're constantly feeling like they're losing control of the situation. So we need to give them the tools that empower them to remain in control of the situation. So at this point, I'm going to turn it back over to Lakeland, and she will talk about resources.
Thank you so much, Kyle, for all of those great tips. I love the SIMPLE acronym that you use, and I hope that all of you find that helpful, along with all of the other great tips that Kyle and tips and information that Kyle just provided. I'm going to leave this resource slide up here as we transition into questions in just a minute. But for some great conversation starters, you can go to letstalkaboutrx.com. And then there's some other great resources up there on medication management solutions, such as Simple Meds, and other resources such as the Senior Emergency Kit that includes a medication list. So we talked about how important it is to keep those up to date. So that is something to download and to work with your loved one on. If you're transitioning from the hospital home or being discharged from a long-term care facility, that returning home guide at returninghome.com can be very helpful. And oftentimes we get questions about medications that are not safe for older adults, and the Beers criteria medication list is a great resource for going out there to search which medications are not generally recommended as safe for the older adult population. And then, of course, if an individual has substance abuse problems, there's some information there, and various public awareness campaigns and drug take-back information is out there online that can be very, very helpful. So I know we only have a couple minutes left for questions, but I want to thank you all so much for joining us on a really important topic. If we can help the older adults that we work with better manage their medication, hopefully it'll help them remain independent longer. It'll help them manage those conditions that they are living with in a more safe and efficient way. So with that, I will turn it over to Steve for a couple questions.
Okay, thank you very much, Lakeland and Kyle. It's time for the questions and answer period, everyone, so send in your questions right now, and we will get to them here. The first question for you, are there medications that could yield to alterations in test results by cognitive assessment in dementia conditions?
That is a good question. I'll give my first thought on this. I mean, there are some medications that could impact an individual's cognition, but I think well, Kyle, do you have any initial thoughts? I mean, if they're taking a cognitive assessment, could medications impact that? That's a really good question. I'd love to hear your thoughts.
Yeah, I think the answer is yes, definitely. Lakeland, you mentioned the Beers criteria medication list. That's really the big one. Most of those are what are deemed high-risk medications, and they can impair cognitive function, which would impact that type of exam or test assessment. But also, those medications can contribute to falls, increased risk for bleeds, internal bleeding, those types of things. So I would highly suggest that with that type of question to refer to those Beer criteria medication list.
Okay, thank you. Next question, can you please repeat the 4 signs of medication adherence?
4 signs of medication adherence. So we had some, medication adherence. Yes, let me get back to that slide on my notes. So common medication adherence challenges. I'd mentioned getting timely refills, remembering to take medications. Kyle, do you have any to add while I read through my notes quick on what I mentioned around medication adherence?
Yeah, so was the question the 4 common signs of medication mismanagement, or what? Could you repeat the question? I'm sorry, I'm not seeing it here.
It was, could you please repeat the 4 signs of medication adherence? I'm not sure if we covered that.
I'm not sure that we covered that. I know we talked about signs of non-adherence.
Okay, I think I found it in my notes here. We talked about, so if a medication is taken properly, it's taken according to the prescribed dose, the time of day, the frequency, and the direction. So all of the things that are listed on usually the pill bottle, if all of those are being met, then it's considered to be adhered to properly. Is that right, Kyle? Would you say that?
That's correct. Yeah,
that's correct.
I would agree.
I hope that answers that question.
Okay. Very good. Thank you. Next question. I believe that the CARE Act through the federal government has mandated a caregiver at discharge for every patient, including older adults, who will act to manage their instructions, including medication monitoring. Is this accurate?
That's a good question. I'm familiar with that act. I need to read into the details, but thank you for bringing that up. I think that there is a movement within the senior care industry, the aging industry as a whole, to assign a caregiver to an older adult in a hospital system to identify the family caregiver, and hopefully that will help with that discharge plan. I think if you're working with family caregivers, it's important for them to communicate to the healthcare providers, if they're in a hospital setting or a rehabilitation setting, that you are the family caregiver, you're the one that's going to be helping out, and you can really be an advocate for the older adult. And I think that the legislature and hospital systems are really seeing caregivers as almost the second patient. They can provide just as much great information and insight. They can be key to medication compliance and also just the discharge plan as a whole. So I will look into that, but thank you for bringing that up, because that is something that's very, very important, and I would hope that it will be implemented nationwide if it's not already being done.
Okay, well, unfortunately, we've reached the end of our hour here, and it's time for us to wrap up. But Lakeland and Kyle, I want to thank you for joining us here today on this very important topic. Thank you so much.
Thank you, and thanks, everyone. Have a great day.